Good afternoon. My name is Tom Barnard, and I am part of the Masters in Public Health program here at Creighton University. As part of National Public Health Week, we are going to have a little roundtable forum here with some experts from Omaha. I'm going to let them introduce themselves here in a minute, but first I want to introduce our topic, which is obesity and childhood obesity. Since the 1960s and in recent decades, obesity and childhood obesity rates have steadily climbed to the highest records to where they stand today. In 2012, nearly 18% of children ages 6 to 11 were obese, and 21% of children ages 12 to 19 were considered obese. Currently, rates in Omaha reflect the national rates of 15% of children ages 2 to 4 being obese, and almost 1/3 of the Omaha metro population suffering from being overweight or obese. Being overweight and obese is a serious health issue. It can cause many chronic illnesses down the line. It increases your risk in children's risk for diabetes, asthma, higher cholesterol. It also puts children at risk for psychological and self-esteem issues through some really important developing years in their lives. There are many efforts being done to reduce the rates of obesity and to provide healthier options and active lifestyle options for children. And we have some experts here who work in the field, or work in different fields related to obesity and child nutrition and living an active lifestyle. So I'll let them introduce themselves, and then we'll get started with our discussion. Dan?
Okay, yeah. Dan Schober. I'm a research scientist at the Gretchen Swanson Center for Nutrition here in Omaha. Also work at the University of Nebraska Medical Center. A lot of the work that we do is evaluation of childhood obesity programs. We also do some research in topics like breastfeeding. And we partner a lot with national partners who are working to try to address childhood obesity.
Kelly Buckstein. I am a Healthier Communities Administrator with CHI Health in our Healthier Communities Department. And we are primarily focused on childhood obesity prevention here in the Omaha area and throughout the state. Do a lot of work within sustainable school wellness and childcare policies, really shifting the culture around health and nutrition and physical activity, build and work on community capacity building so that initiatives can sustain through a long period of time.
I'm Lori Chickentele, and I'm a registered dietitian. I've done some work here in the Omaha area as a consultant with the Midwest Dairy Council and Allegiant, and I have worked in the past in other states, Missouri and Louisiana, in areas of weight management, also in the area of pediatric weight management.
All right, great. So we'll get started with our first question here, and kind of the big question is obesity and the childhood obesity epidemic. Some people kind of hear this term epidemic and get scared away or think it's a little drastic, but I don't think it is, and I think it's something that needs to be addressed and something that we're all working to address. So what do you think, Dan, has been one of the main contributors that has brought us to where we are in the obesity epidemic as it is today?
Mm-hmm. Well, there's a lot of contributors across a variety of different ecological levels, from the broad cultural and policy level down to the individual level. But I guess if I had to say one of them, I would say just our lifestyle has changed dramatically in the last 40 years in terms of household lifestyle, two parents working. People just don't have the time they had 20, 30 years ago to do things like scratch cooking. It's harder to find time to be physically active with your kids. So I think there's a lot happening at the family level with lifestyles.
Kelly?
I absolutely echo what Dan said. I think it's a complicated issue, and there's a lot of factors over time that have influenced the epidemic. And to your point, I think it is an epidemic. You mentioned earlier the concerns around chronic disease and health issues that are associated with this, but it's actually bigger than that. It has really huge impacts on our children and their readiness to learn, their success in school, and really implications throughout life that impacts their mental health, their employment status, all of those things. And so we know that it is a complicated issue that's bigger than just the cosmetic factor of weight.
Mm-hmm. Absolutely.
And I agree with all of those items, and there's multiple points we could discuss, but also just even the industry impact on obesity. As we have more larger companies and we become more industrialized, we have companies that are targeting children with advertising for taste preferences, for brand loyalty, and even for the incentive of making a profit. And for those industries, it is desirable to sell more product. And we do know that children are on average consuming about 200 calories more today than they were 30 years ago. And those 200 calories are profit for industry.
Mm-hmm. Yeah, so a lot of good points there. What I draw from that is there's been a lot of changes in our overall environment that we live in today. I think there are a lot of different factors when you talk about environment, but I think it's very clear that not all children are granted the same opportunities in terms of access to healthy foods. Schools, not all schools are serving the same foods. Children just aren't really receiving the best nutritional content they can. So what about the environment here in Omaha specifically maybe creates a barrier for some children, maybe as opposed to living in North Omaha compared to West Omaha or South Omaha? Kelly, could you talk about some of the geographical issues that play a role in this issue?
Sure. And I think it is a really important point because we have to remember that kids don't choose what foods are available to them, and they don't choose when they have an opportunity to be physically active. So those environments and those caregivers really play a key role in those opportunities. And we need to remember that, it's not all about the kids. It's really a much bigger picture. And we definitely see huge disparities in access both to healthy food options and physical activity when you look at different areas of town. Here in Omaha, that has to do with the way our environment's designed and safety, both related to crime, but also related to safe places with good lighting, areas that are picked up, don't have trash and litter and those types of things. And there's definitely parts of town that there are differences in that. So we know that influences physical activity. Kids may not be safe walking from home to school or to after school programs. So there's limitations there. We also know that there are areas of town which I know Dan can speak to more, that are considered either food deserts, meaning that there's a lack of closely accessible healthy food options, or a new term, kind of food swamps, where they're really just inundated with fast food and convenience stores that maybe don't have healthy options. And then there's a food price issue as well. Unfortunately, our processed, quick, easy foods are much cheaper. And so if you look at populations that tend to be of lower income status or have lower education status, unfortunately that's going to influence their opportunities to buy healthy foods, which are typically more expensive, although there's a lot of ways that families can work around that. And we'll talk more about it, but there's some really great supports within the Omaha area and within our systems that can help families make healthier food options. So there are definitely barriers to access throughout different parts of Omaha, although a lot of these choices are difficult for any family, which I think is important to recognize. And a lot of great work that is going on and can continue.
Mm-hmm. You said some really interesting things there about food deserts and food swamps and children in different parts of town having access to healthier foods. How big of an impact, once getting access to those healthy foods, how important is it for parents to understand how to work with those foods and present those foods to kids in a way that makes it fun for them to eat or exciting, so they are more excited maybe to go have a banana or carrots rather than French fries and chicken nuggets. Lori, do you have any?
Well, a couple things. You hit a couple things. I mean, obviously environment is huge, and it's the environment that starts early on from just in utero. And so maternal health is extremely important in preventing obesity, because we know that women that gain excessive amount of weight even during pregnancy yield children that tend to have obesity and weight issues going forward. So many of the environments that children live in are created by adults, by us. And so we do need to look at, how we can move forward to create an opportunity where children want to choose healthier foods. But trying to market a banana to a kid is very difficult. I'll go back to my industry question, situation. But it's hard to try and sell that child on a banana when big industry has machines out there where you can pick the flavors of your sodas and get it just to your likings. And then that information goes back to the company as test environment for knowing what is palatable to kids, so then they can further advertise. So it's really hard sometimes when you're counseling or you're trying to create programs to make this stuff very desirable for kids when they're getting big advertising and big name recognition, and there's associations for kind of who the child is around the marketing of these products. Mm-hmm. Things, though, that are being done are these small little grassroots programs that are going into schools and really trying to empower students. And I think that is really where one of the biggest answer lies, is empowering students to understand that the responsibility is theirs, that their body is their body, and that is one part that they have control over. They don't always have control over the environment, but once they can start to assume that and understand that their physical health is somewhat dependent upon the choices they make, then some of these programs will start making sense to them. And there are so many programs in Omaha that are out there in the schools, in the preschools, in the child care centers that are trying to teach healthy cooking, teaching an exposure to a variety of different foods that are not coming into the home, so that kids can learn to develop taste and texture differences that, when you're just served certain things all the time, it's very difficult to want to like something or want to smell it or want to even look at it or try it. But when you're amongst your peers that are all 4 years old and they're looking at that going, this is kind of a neat project, we're going to peel this, we're going to cut it, we're going to touch it, I'm going to smell something different, it becomes of interest. And it doesn't mean that they may go home and have that product, but it starts empowering the child to realize there is some control, there are other options out there, and we're starting to take steps in driving this in a different direction. And so those are the environmental changes that are happening locally with all of these programs.
Yeah, I think that is a really good point. I think you touch on something there about children being exposed to healthier foods, kind of in school settings, where they can learn with their classmates and be interested and get hands-on exposure to learning how to cook or learning how to grow a garden, which kind of leads me into a really good point here. A lot of children don't even spend their time at home. There's majority of their time is spent in daycares or in school, in grade school, in preschool, after school programs. So a lot of responsibility can be taken on by these schools, making sure that kids have foods that are healthy, that they're fed at appropriate times throughout the day. Dan, would you like to talk about the schools and kind of their role in children's health and nutrition and getting those healthy meals?
Sure. We work with early care and education, which would be everything from birth up through basically kindergarten. We also do some work in schools as well. And to the previous points, access is important, and you obviously can't eat healthy foods unless you have access to them. But in addition to that, you need to really create the conditions for kids to want to eat them, which is one of the big debates right now with the school the policies. The Healthy Hunger Free Kids Act is, there's certainly a constituency of people that say that kids just don't want to eat these foods. They get wasted. It costs the school a lot of money. And it becomes a big problem for communities. But there are a number of things that you can do to try to make it more likely that they eat food. So they say 10 to 12 exposures is what's necessary for young children to really start to like certain foods. Broccoli is maybe one of the classic examples of food that kids don't like. Any dark leafy greens, I think everybody knows a child who doesn't like those kinds of foods, but 10 to 12 exposures. I think it's a good rule, but in addition to that, you've got to create the broader conditions. So there's a lot of programs here locally that try to get kids involved in every part of the food experience. So growing foods in community gardens and really getting them to invest in producing that, and knowing where that food comes from, and taking pride in the growth of that food itself. Then preparing it, washing it, cutting it, cooking it. And I think that there's numerous examples across the country, but also here in Omaha, where if you're able to do that successfully and convince the busy teachers that should be a part of the curriculum, that it changes the way kids feel about food. It changes their relationship to that food. And therefore, they're much more interested in eating it than if you just put it on the plate and say, eat it. So I think that's a big part of it. When kids get older, they obviously then have more choice, and it gets a little bit more challenging to get them to eat certain foods. But I think one of the things that's important is to try to start early. And so there's a lot of attention now in early care and education, and with younger kids where the food preferences are really starting to be developed. So to get them involved in that, to get them liking those sorts of things, or at least appreciating that. And a lot of the rules that people were exposed to as kids, which are things like, eat this all before you can leave the table. There's a lot of dietitians and a lot of public health people saying, that's not a very good way to go. Let kids experience food, let them touch it, let them smell it. They don't have to eat it all, but they have to, there's different rules. Some say you have to try some of it, but don't force it. So I think that's a big thing as well. Get it started early and let them really experience it in the ways it makes sense to them.
Can I add something to
Absolutely.
the school wellness piece? So I think one of the things that we need to emphasize with our messaging around schools is their job is to educate kids and help them learn and help really prepare them for life. And policies have inadvertently sent schools in a direction away from health education and healthy foods and physical activity and physical education. And that wasn't intentional. Those changes happened over the last decades to really promote learning. But what we know is that eating a good breakfast and having nutritious foods and having a lot of activity time actually does promote learning. And so really making that connection back to, again, helping these kids learn, helping them be successful. And I think that's a really important environmental shift, policy shift that is starting to happen. Many schools are absolutely bought in and know that research and get it, and some are struggling to then figure out, okay, what does that really look like within our efforts? But that connection between learning and these healthy habits that we're talking about is really, really important, and we need to make sure that that's a focus of the work that we're doing, and we're not just focused on the health side of things, which is, of course, very important, but the learning element is also really critical with schools.
Yeah, I think that's a great point, Kelly.
Actually, if I can just add one little thing, as we bring these programs to schools and we start seeing the outcome of them. And for example, I believe Kearney and Lincoln are two places in Nebraska where we have seen a decline in obesity because of programming that has gone into the schools. And they had funding and they had programming. And so now we can look at those areas and we can say, what are the programs that they're using? We can use them as models to go bring to other cities and other areas in Nebraska and across the United States. But also, when we have all these programs developed and we are showing where the success is, it allows us to go to our legislators. It allows us to go to our city planners. It allows us to start instituting bigger policy that is going to further drive, hopefully, the cost of the more healthy foods down, and hopefully also drive up the cost of the unhealthy foods, because it is that battle that is out there that is making it very difficult for schools to meet the criteria to feed children. Because it's great to say we're going to serve broccoli, but if you've got huge plate waste and they're seeing that, it's not affordable for the schools, and getting the fresh is very expensive. And so we are doing programs. There's a lot of schools that are doing different try-a-bites and tastings, and where they're not even serving full portions, but they're just trying to get the kids to want to buy into this. But also, if the ingredients and the food items become more affordable, then it's easier for people to plan, and it also gets marketed too. I mean, once you start taking ingredients out of things because there's either a taxation that's placed on something and all of a sudden industry can't use that particular fat anymore because it's not affordable. They're not going to be able to make a profit. Then they start looking for other solutions. Then all of a sudden the food will start getting a little more healthy. So all these programs that we're doing have a twofold effect. They are helping the children initially learn, develop, make changes, hopefully take on healthier lifestyles. But they also have the effect over a more global perspective of what we're doing as America.
Mm-hmm. That's all great points. Thank you. There's a lot tied in there. I think, though, Lori, I was going to maybe ask you if you could expand a little bit on, we're in such a fast-paced culture, and everything's kind of grab and go, so it is difficult to sit down and prepare a meal with a lot of fresh ingredients. How can or how have schools or restaurants kind of tried to make changes in their menus to provide healthier options? And for example, if a family is on the run and they have to swing through fast food, how can they make a healthy option when going through a drive-through? Because some of these restaurants you're starting to see they're listing calories and they're adding options for fruit for a side instead of french fries, but that's not always easy when you're at the restaurant with a little kid who wants those foods. What can families do to kind of make healthy options when they are on the go, when they are on the run?
That's a difficult question because I think our society, I think that is part of the problem because our culture has changed in such a way that time is a huge factor. And you can't just all of a sudden say, okay, we're out of time, now we're going to go home and cook. And that is part of the uncomfortable situation we found ourselves in because when families only have 15 minutes for dinner and the options are out there, what are they going to choose? It's tough. And I'm not saying there's great answers. I'm not saying that I could tell you where to go and pick a great meal from McDonald's. There are restaurants that maybe have better options. You might be better off going through a sandwich shop than going through a McDonald's or going to Chipotle type restaurants. But at the same time, it's still taking away from the concept of being at home, being able to demonstrate cooking, being able to smell food as it's being cooked, being able to watch the process, being able to taste raw ingredients as a parent is perhaps cutting up broccoli. There are so many learning experiences that occur in that environment that it's just not there anymore. And I think that is part of our problem, and it's a time problem. And I'm not sure that the solution is driving somewhere and picking up food. I think we need to look at our entire culture and say, how are we going to shift things to create a more healthy situation, either at home or, as Dan was mentioning, even in institutions where we are teaching kids on site how to do this sort of food preparation so that perhaps they learn the process and they desire that, and we start driving the culture to basically recreate time again, because it's time that's being missed and it's time that's affecting our health. And it's the lack of time for exercise. It's 24/7 businesses that expect people to work all the time. It's driving our culture and it's driving the obesity.
I just want to add to that. I think I echo Lori's comments that this is a huge challenge and families are faced with that. And unfortunately, that's the reality right now. And so a couple of the messages that we really repeat to families is make sure you offer healthy choices. So you're not saying, do you want carrots or a cookie? Kids are going to pick a cookie. They're going to pick the chips. But getting in the habit of apple slices versus carrots and really making sure that as much as possible we can offer those healthy choices so the kids have a choice. I think that's really important. And I can't emphasize enough the importance of role modeling. And so making sure that if you're going through the drive-through, maybe mom is picking a low-fat milk instead of a soda. Really trying to be a good role model for those. Maybe saying, hey, we're going to have fries today, but we're going to split a small fry so that we can really start to think about portion sizes. Because it's hard and no one's ever going to be perfect, and that's not realistic. So we need to figure out how to make health a priority and make sure that there is a balance. We're always going to have that brownie someday or that Sunday or whatever it is, and that's how life is. But making sure that we're offering healthy choices as much as possible, having conversations with kids about those healthy choices, and then role modeling is so important.
And then, Kelly, if I might even just add another thing, because that is absolutely true. But the other thing is, too, it's not always just the meal. It's that in-between eating, and that's where some of the unhealthy snacks, there's a lot of unhealthy snacks that kids will just eat because of the situation they're in, whether they're at a soccer practice and it's being served to them, or they're at school and there's peer pressure to have these products. But it's the stuff that's in the pantry at home. And it's not always that one hamburger a week that they're hitting the drive-through. But, really encouraging families to open up their pantry and really see what are they being motivated to buy at the grocery store, and what is coming into the home, because those are the foundation and the building blocks to what the family eats the majority of the time. It's not the school lunch that's causing obesity. Mm-hmm. And it's not the occasional trip to fast food.
And I would also say that it doesn't need to necessarily be a Thanksgiving dinner type meal. There's a lot of emphasis on just very simple, healthy meals. They're not going to be perfect, but you'll do better than you will at a drive-through. And there's a variety of options that can be made very quickly. And so some of the local programs try to teach, things that are feasible and possible and won't take an hour and a half to prepare, but maybe 20 to 30 minutes. So some nights you might have to go to the drive-through, but not every night. Hopefully you can get some of those simple meals in there and just have the whole experience of dining together as a family. There's a variety of other benefits besides just health benefits that come with that range from social benefits to behavioral, healthy behaviors and things. So that ritual of a family meal a couple nights a week at least could go a long way in many different ways.
So those are all great points. Dan, you mentioned something I would like to expand a little bit more on. Family style dining is kind of a term that you hear thrown around. Kelly, would you like to talk about that a little bit more?
Sure. So one of the main campaigns going on right now within the Omaha area is the Family Dining Campaign. And this was actually created by local health educators and dietitians and teachers that kind of came together and said, how can we get a message that fits within all the work that we do, but can really help families learn how to promote health and establish healthy eating within their family. And family dining, as Dan mentioned, is a really great message that helps offer that opportunity for parents to role model healthy options or healthy eating, that provides the opportunity for healthy options. And that social interaction with family, we know impacts children's ability to have success in their academics, to build social relationships, friendships, they're less likely to engage in risky drug use behavior or sexual behavior. So a lot of really important benefits that come with that family dining experience. And it doesn't necessarily even have to be dinner. We talk to families that say, I've got soccer practice and theater practice. Well, maybe breakfast is that time for you. But also it's really important to establish some of those opportunities within childcare environments. Again, when children are starting to learn healthy habits and starting to learn nutrition, they get a lot of benefits from that interaction of sitting down at a table and having a educator with them talking about healthy foods and learning how to pass foods around, serving portions that are actually appropriate for them, helping kids recognize hunger and fullness. We're actually born with the ability to recognize hunger and fullness as babies when we're breastfeeding, and then our culture kind of shifts over time. And you talked about, clean plate club, finishing everything on your plate. So that family style dining within childcare environments allows kids the opportunity to really learn about those cues and about eating healthy. And so there's a lot of elements within family dining that are important throughout a child's experience.
I think that's just a really great point. I think family style dining, to some of the points that you mentioned, you talk about kind of reduced rates of crime or risky behavior for children, which obviously can have adverse effects on their health. But what are some of the kind of long-term risks that these families and children are putting themselves in by consuming less healthy food options from such a young age through the rest of their life? What are some of those chronic risks that can really change a child's life, do you think? Kind of starting from eating at day one, like you said, in utero. If the mother is healthy, then the baby has a better chance.
So you're talking about the medical risks that the
Yeah, kind of like the medical risk as you grow. If you continue to choose unhealthy foods, what can that do to your body?
Well, we know that those individuals are more prone to diabetes, heart disease, asthma, a variety of things. They have problems with orthopedic type issues because of the weight bearing on their joints. What am I missing?
I think one of the biggest
But I mean,
elements of
obesity
this,
diabetes is
Yeah.
huge.
and I think one of the major points is that we're starting to see children that are experiencing these health issues that previously weren't existing. So it used to be adult onset diabetes, and now we see that in children. Coming from the healthcare field, we know that pediatricians actually aren't trained to deal with a lot of these diseases, and so there's a new element of healthcare that's evolving around training pediatricians differently to be able to deal with some of these health
Onset
issues.
severity. I mean, there's so many of them, and just the whole fact that the healthcare costs are just going up so high because of all these secondary issues that the children are developing. So,
Right.
and the whole perpetuating it forward, because if you really go back to that environmental issue of, adults are responsible for the environment of a child, even in utero, then you've got somebody who's already overweight, who's growing up, perhaps going to stay overweight, and that is the environment they're passing
Perpetuating,
forward.
right.
And
Absolutely.
Yeah, huge costs. The estimates are in the neighborhood of 200 billion a year, just from medical costs and all these chronic diseases and things. And that's I don't think that's the problem. That's one of the symptoms of obesity. But yeah, there are just numerous quality of life issues, that, diabetes and all that, but also length of life too can be affected by chronic disease. So there's talk that maybe this generation's not as healthy as the previous generation, which is sad when you think about it, due to all these different reasons. So there's a lot on the line here.
Yeah, absolutely. I think something that we've overlooked just a bit, we've been very focused on food and nutrition of the food, but I think there are other factors that have changed kind of how active children are. Are there any measures that you are aware of in schools that are being taken to promote more physical activity and less screen time, or other factors that have been influencing childhood obesity?
I can speak a little bit from West Side and through working with Midwest Dairy. I'm helping out with the Fuel Up to Play program in the West Side District, and some of the things that our schools are doing there is definitely adding the physical activity breaks and trying to get those initiated. And that's a hard process, just to get teachers to acknowledge the fact that there are all these websites out there that have these little breaks that are available, and then making the time to stop for a minute or two to actually do them. I know some of the schools created little PSAs where the students put together an informational, and then they sent them out to the teachers so that it would encourage the teachers and remind them that, hey, there's all these websites, get the kids moving. So that is one thing, but trying to get PE offered more frequently than it is. I mean, some schools are making efforts in that area, but other schools have had to pull back in that area because of the curriculum demands. And so it's just not there. And then also creating recess in a sense of just making it active recess, where it's not just kids walking around and, sometimes there's just issues in terms of how do you actually engage the kids out on the playground so that they remain active and they don't just stand. But and then also having a winter plan for those winter days when they cannot go outside, and making it so that they can at least roam in the classrooms or go into the gym and have some activities going on in there so that they are not sedentary on the colder days.
Very good.
With
I was just going to add one more thing I just thought of. The other thing is schools also are trying to use their parent groups and community clubs to create situations that are more active, creating fun runs, open gym nights where they basically maybe once a week, once a month, bring in a special physical activity into the gym and just let the kids come in the evening and spend an hour in the gym doing basketball or soccer drills or yoga or whatever. And a lot of times schools can really make use of their whole district, because I know in our district, our schools have taken the elementary schools and they've pulled some of the high school kids down to the elementary school level and made them the trainers for the younger kids. And it's a great role modeling. We're talking a lot about role modeling, but when you're in 5th grade and you see the 10th grader coming in and you have an interest in basketball, it gives you something to aspire to want to do.
Mm-hmm. Yeah. In terms of measurement, there's been a lot of studies that have used accelerometers, which try to objectively measure physical activity, especially among older kids in high school settings, middle school settings too. But there's a lot of interest now in terms of measurement and in early care and education at looking at the broader environment. So I know this because we've worked together, but looking in early care and education at the policy environment and looking at some of the practices that happen in early care and education centers, as well as some of the actual arrangements of, does the playground have these sorts of things? What sorts of engagement does a teacher have with her students? So it's not just looking at the outcome of physical activity or the further outcome of obesity, but what are some of the inputs of that, the environment, the practices, the policies, and things like that. And the challenge with those, they're very labor intensive. They take a lot of time. You've got to have somebody there to really observe everything. But I think there's a lot of potential to learn a lot and to really understand through that sort of direct observation measurement approach on what's really happening and where can we really make some of these changes where we can engage older kids to be role models or things of that nature.
Yeah, I think that's a great point. I think you mentioned something there about inputs and Lori talking about kind of promoting an active lifestyle and being a little healthier. What are some of those initiatives or programs or efforts being made here in town that are really pushing this issue to the forefront of it is an issue. Childhood obesity is something that is affecting thousands of kids, and what are we going to do about it, and how can we be better role models and help create change in these environments?
I think for one thing is we need to make sure that we have safe zones, because there's a lot of population groups, even in the Omaha area, where they don't have safe, comfortable zones to just be able to go out and freely recreate. And then there's the whole opportunity to create organized activities. We have a lot of organized activities that are out there, but I think sometimes it's the free space, free opportunity to feel that it's a safe place for your child to just go outside and play and roam and get in that activity that is just, without even thinking about it, it's happening. And that goes back to a time issue too, the time management that we talked about, making it very difficult for people to acquire a sound meal in a setting that is ideal for consuming good nutrition. The same formula that is causing problems there is causing problems in inactivity.
I kind of took a deep breath when you asked that question, because it's a big answer to what is going on to really help with this issue, and I think Omaha is a incredible community that's really rallied around this issue, and there's a lot of efforts working at all of those different environments that we've talked about. So, for example, when we talk about food access, there's initiatives around healthy neighborhood stores and really helping train and provide capacity to small convenience stores that probably don't typically offer healthy food options, to really try to integrate that into their system so that they can make a profit and be a successful business, but also provide healthy options to their residents. So that's an example of improving access to healthy options. The farmers markets now accept, and that's been in place for a few years, but SNAP benefits, so that families that do receive assistance for food can actually purchase healthy food options. So a lot of different pieces around access. There's a lot of neighborhoods that are rallying around safe space, renovating parks, creating neighborhood coalitions that are looking at safe activities for kids, that are looking at how can we use our church space to create activity opportunities for kids and get them off the streets and use their time in a beneficial way. There is an initiative called Partners for Healthy Schools that's really emphasizing training teams from schools around best practices in wellness. How do you integrate that into your culture? How do you set goals that are going to last? So there's some great work going on with that includes partners from all around. Midwest Dairy Council is a great example with Fuel Up to Play 60. Health Teacher is a online health education curriculum funded by Children's Hospital. The list is endless, so I'm leaving out lots of partners. And there are policies that folks are looking at as far as how do we improve models to offer breakfast within schools? How do we help schools get funding and figure out how they can offer breakfast to more of their students? Unfortunately, Nebraska is ranked 49th out of 50 in states related to school breakfast participation. But there's some really amazing work that's going on around that. And OPS has actually decided to offer free breakfast to any student, regardless of their eligibility. And so that's a huge step forward in offering healthy options to kids. So the list kind of goes on. And I think another element that I want to emphasize is healthcare. As with the Affordable Care Act, providers are really being called to shift their focus to keeping people well rather than treating sickness. And we don't know yet exactly what that looks like, because obviously we typically go to the doctor when we're sick. And so retraining physicians and looking at the way physicians are reimbursed for care to really promote wellness. So working with physicians on when to screen for health issues, when to have conversations with families around healthy options. There's a lot of work and interest in that area. Integrating school-based health centers into schools is another way to look at that. So I could probably talk for another 2 hours, but I'll stop there. Actually, there's one more thing I wanted to mention based on one of the earlier conversations, particularly around physical activity. There's some really important data related to the efforts in Kearney and Lincoln around fitness and academic success. And what we've seen is if you actually look at fitness levels of students, that the higher fit kids are actually doing better in school with their achievement tests. And so I think it's a really important point, again, around schools with that learning connection, that there's both elements of nutrition and physical activity. And the reason that we don't have time in the day is because of the emphasis on academics. And so infusing, again, this research into the school day, that this actually, if we can take those times for the activity breaks and providing breakfast, that we actually are contributing to higher academic success.
Mm-hmm. And I've seen some studies that show relationships between better math performance and being non-obese. So it's interesting. I don't think the mechanisms are entirely clear, but there seems to be a relationship between academics and overall health. That was a great description that you guys gave. The only thing I'll add to it is, I was at a symposium this morning about childhood obesity prevention, and there were 10 different agencies that worked on obesity with a grant. And there are all these great programs that do this, and there are programs like the HEROES program at the Children's Hospital Medical Center that really focus on clinical obesity. So if you were to do a TV show about obesity or something, you'd picture the kinds of kids in this clinic that you'd see on TV. So there's the very clinical examples, but there's so many examples of organizations and agencies that may not call themselves obesity prevention initiatives, and they may be doing youth development sorts of things, or the Girl Scouts is one example. And there's been studies that have engaged the Girl Scouts as an obesity prevention approach, but there are so many different agencies here in Omaha and across the country that really can promote healthy lifestyles and health education and things of that nature. So just one example I'll give here locally is Whispering Roots, which is an aquaponics, an agency that does aquaponics. So they bring in fish and they bring in the ability to grow its lettuce and different greens. So it's kind of a science lesson, and it incorporates academics, but it also incorporates healthy eating, because the kids actually eat what they grow. I don't think that they call themselves an obesity prevention organization. It's more of an educational organization, but they're doing that. And I think that gets to the point of obesity is such a cross-cutting issue that you can't just have people have a laser focus on obesity. You have to have really everybody at the table to really help move the dial back on the rate of obesity in children. So it's just such a complex issue.
Yeah, I think those are all really great points. It's amazing just here at this table, how much you guys have been able to share about kind of the risks of obesity and kind of what is being done, the efforts being made to kind of improve the health of our children and of our families and our community. Does anyone have any final comments or anything else they'd kind of like to add at the end here?
Just don't give up. We just need this advocacy to keep being propelled forward, because it's not going to be a solution that comes in the near future. It is something that we have to cultivate and continue to perpetuate forward. So all these different groups that are doing all these little steps, the little steps help create the bigger level policy, and the policy is what is going to drive change.
I would just say that I think health is a basic human right, and there's a lot of ways to get there, but one way is, I think, to prevent obesity because of all the later life things it can lead to. And I think that health is up there with education and with safety. So by preventing obesity, you're giving people, I think, one of the most important human rights that they have.
All right, well, I think that concludes our roundtable. Thank you all very much. I think it was very informative. I know I learned a few things. So I hope you all enjoy.
Thank you.
Thank you.
Thank you.